Imagine a bustling elderly care facility, or maybe a home health aid. They're already stretched thin, right? And then there's this constant demand to adopt new practices, new tech.
New ways of working.
Exactly. And it's a huge challenge everywhere. Our population's aging, demands on healthcare are rising, but resources, well, they're often limited.
Yeah.
So the question is, how do we make sure these vital new ideas actually stick? How do they get implemented when staff are already giving everything? Today, we're doing a deep dive into some critical research that offers a kind of shortcut, a reliable compass, maybe, for managers to really hear what their frontline staff need to make change happen.
That's a great way to put it. Because, it's not enough to just have the latest knowledge or some smart new device.
Right.
The real hurdle is making sure the healthcare staff are motivated, yes, but also supported, truly able to continuously translate these innovations into what they do every single day.
So it requires really understanding their needs on an ongoing basis.
Exactly. Understanding and responding effectively.
And our focus today is a specific tool designed for that exact purpose, the Implementation Process Assessment Tool, or IPA. We're looking at its newly translated and evaluated Swedish version, the Swe-IPAT.
Used in municipal elderly care over there.
And our mission, to really pull out the insights on how we can better support those dedicated people on the front lines. Okay, so let's unpack this. You mentioned the IPA. For listeners maybe not deep into implementation science, what is this tool? What makes it special?
Right. So at its core, the IPA is basically a questionnaire, 27 items, and it's designed specifically to measure how healthcare providers perceive their needs while they're trying to implement new ways of working. And it's not just plucked out of thin air. It's built on a solid theoretical foundation, grounded in established frameworks from implementation science.
Which is the whole field about making change actually happen in the real world, right? Not just on paper.
Precisely. It's about bridging that gap between knowing what works and actually doing it.
That makes sense. So for this Swedish version, the Swe-IPAT, how did they validate it? What was the process?
Well, they took a really careful, robust approach. First, obviously, a meticulous translation from the original Norwegian IPAT into Swedish.
Okay.
But then, and this I think was really crucial, they did think aloud interviews.
Think aloud.
Yeah, they sat down with 12 different staff members, nurses, licensed practical nurses. I think even a physician was included, a real mix.
Diverse group.
Very. And they basically asked them to think out loud as they filled out the questionnaire. What does this question mean to you? Is this wording clear?
So they could see if it actually resonated, if it made sense in their specific context, Swedish elderly care.
Exactly. It was vital for ensuring clarity and relevance. Interestingly, they did simplify some words based on that feedback, made it a bit easier to understand, but they kept all the original 27 items. None were thrown out.
So they fine-tuned it with that direct feedback. What was the next step then to test it more broadly?
Right. So once they had the refined tool, the Swe-IPAT, they rolled it out in a larger cross-sectional survey.
Like a snapshot in time.
Kind of, yeah. Taking a reading across a large group. This involved 305 staff members, all working directly in municipal elderly care, so nursing homes and home help services, real frontline staff.
And what did that bigger snapshot tell them? Did the Swe-IPAT prove itself useful?
Absolutely. The psychometric evaluation, which is basically the rigorous testing to see if a tool reliably measures what it's supposed to measure.
Does it work?
Yeah, does it work reliably? It showed satisfactory properties. So basically, it confirmed the Swe-IPAT is a dependable tool, that reliable compass we mentioned.
Okay.
And the analysis also pointed towards 3 sort of key underlying factors that influence how implementation goes.
What are those?
Broadly, they were individual phases for behavioral change and perception of the intervention, so how each person sees it and moves through the change. Then individual activities, like what people actually do. And finally, collective readiness and support, so the team environment.
Okay, here's where I think it gets really interesting. Because you might assume staff are often the barrier, maybe resistant to change. But this study found something more nuanced, didn't it?
Yes, this was the real aha moment, I think. What they found was that most staff members actually showed high awareness, motivation, and self-confidence about the new practices.
So they were on board, they understood it, they were willing.
Generally, yes. High scores on things like awareness and willingness, but, and this is the kicker, they also reported really quite low levels of perceived facilitation and support coming from management.
Wow. So motivated staff, but feeling unsupported.
Exactly. For instance, there was one specific item. I find I get necessary facilitation from management to succeed in the improvement work. the average score for that. Just 3.21 on a scale from 0 to 5.
That's noticeably low. That's not just a number, is it? That's a direct message.
It really is. It's critical feedback. It tells managers, look, your staff want to do this, they're motivated, they feel capable, but they need your active help. They need you to clear roadblocks, provide resources, offer tailored support.
Otherwise, the motivation doesn't translate into action.
Precisely. Even the best intentions can stall without that practical support. And that's where the Swe-IPAT comes in. It gives managers that just in time, just what we need kind of information to actually help their team succeed.
Okay, so pulling this together. The Swe-IPAT isn't just an assessment tool. It's a practical instrument for constructive, real-time feedback.
Mm-hmm.
It lets managers see what's happening on the ground, assess how implementation is going, but crucially, it tells them how to tailor their support to make change stick.
Exactly. And if we connect this to the bigger picture, truly understanding these, quite nuanced perceptions of staff, it's absolutely essential for making changes last, especially in complex, very human environments like elderly care.
It moves beyond just assuming everyone experiences change the same way.
Right. This kind of tool has the potential, I think, to really transform how new practices are introduced and supported, make it much more targeted and ultimately more successful.
So what does this really mean for you? Listening right now, it's a powerful reminder, isn't it? About the impact of truly understanding and responding to people's needs during change, whatever the context, not just telling them what to do. So here's a thought to maybe mull over. If continuously assessing staff needs, like the Swe-IPAT allows in healthcare, can genuinely improve quality and effectiveness, what crucial, maybe often unaddressed support needs might exist in your own work, your field, or even just your daily life? Needs that, if we actually identified and addressed them, could unlock much greater effectiveness, maybe even more well-being.